Chair RB, Rajesh and myself are honored and privileged to deliver this annual SASC report. 2020 has been the most profoundly and unprecedentedly challenging year that our profession, the NHS, and indeed the world has faced in a generation. It is difficult to understand the depth and magnitude of the lasting change that COVID 19 is likely to have on medicine, societies, and economies across the globe. What we can be certain of at this stage is that doctors and other healthcare staff in our NHS have tirelessly and selflessly risen to the challenges this pandemic has wrought and have often paid a high personal price for this dedication. Tragically, some of our colleagues have made the ultimate sacrifice in the pursuit of providing care to their patients. Sadly, of the first 10 doctors to lose their lives fighting the pandemic in the UK, 5 of them were SAS doctors.
As a grade, we have applied our skills and knowledge diligently and adapted well to the new working practices, such as changes to rotas and remote working that COVID 19 has imposed upon us and will continue to do so. Available evidence around COVID 19 indicates disproportionate impacts for people from Black, Asian, and minority ethnic backgrounds. This is particularly significant for SAS doctors, as 70% of SAS and locally employed doctors on the GMC register achieved their primary medical qualification outside of the UK. SASC has empathetically supported the need for a robust risk assessment tool for all doctors to use. This has involved contributing to the development of BMA's COVID 19 risk assessment tool, which helps the doctors to quantify biological risk in supporting their work-based risk assessment. We have also co-signed with fellow secondary care BMA committees a letter to all trust chief executives in England on the increased risk of COVID-19 faced by hospital staff, with a particular focus on BAME staff. We also worked alongside our fellow BMA committees to ensure that the concerns around PPE availability for doctors and healthcare workers are addressed. In May 2020, the BMA agreed in negotiation with NHS employers to publish a joint advisory notice to make sure that working arrangements for SAS doctors implemented to contend with the height of the pandemic are only in place temporarily during the fight against COVID 19. Listening to the voices of SAS doctors, we contributed significantly in the development of the BMA's extensive guidance on redeployment during the pandemic so that they felt reassured and redeployments took place safely and only with the doctors' agreement.
While the fight against the coronavirus has dominated this year, SASC has been determined to not allow the pandemic to halt our fights and improve the lives of SAS doctors. In doing so, we are proud to announce that over the past few months, we have secured a number of significant successes. Chief among these has been our continued negotiation of our contracts with NHS employers in England and recently joined by both employers in Wales and Northern Ireland. These formal discussions, which began early last year, will see a new job title and career path equivalent to the associate specialist grade and a reformed specialty doctor grade unveiled by April 2021. The outcome of these negotiations prove that SAS doctors are increasingly valued, respected, and beginning to receive the recognition and consideration they have so long deserved. In addition to our dialogues with NHSE and the Department of Health, we have also expanded our engagement with other key stakeholders. Amongst these are our ongoing discussions with the GMC over the future of CSER. We are told the application rate has increased and so has the success rate, which is always a positive. SASC, through the BMA, is the only group to advocate on behalf of SAS doctors, and we have continued to impress upon the DDRB. The review body has previously praised the contributions of our grade while noting the historical lack of recognition we have received. In its latest report, the DDRB made clear that while we continue to be crucial but undervalued, we are also continuing to deliver critical services alongside the consultant workforce. In response, the government this year announced that SAS doctors would see a 2.8% increase in pay from April 2020. This means that since October 2018, the salaries of SAS doctors in England have cumulatively increased by 8.3%. This award on pay is tangible proof that as SAS doctors, we can successfully lobby on our own behalf on the issues that matter to us and have our voices heard. Further evidence of this can be found in contents of a new set of shared principles produced as a result of our collaborations with Health Education England and NHS Improvement. Known as Maximizing the Potential of SAS Doctors, this guidance sets out 11 commitments designed to support and enhance the working lives of our grade. Most notable amongst these is a promise by HEE that it will ensure consistency of funding for SAS doctors, both geographically and in activities funded through SAS tutors and associate deans. This commitment is considerable if we reflect on how the SAS funding has been diminished and reduced to a postcode lottery in recent years, and we look forward to these and other commitments made in the framework being implemented. Yet, while progress in important areas has been made, as SAS doctors, we continue to face challenges, many of which are long standing and deep rooted.
Last year, the GMC conducted the very first survey of SAS and locally employed doctors in its history. While the decision to speak to SAS doctors about their experiences and concerns was in itself a hugely welcome one, the findings of these investigations were not. Of the more than 6,000 doctors taking part in the survey, 30% of SAS doctors said that they had been bullied, harassed, or undermined by a colleague in the previous 12 months. Even more disheartening was the 61% of SAS doctors who either disagreed or strongly disagreed with the statement that the role of a SAS doctor was viewed as a positive career choice within the medical workforce. Since the publication of the GMC's report, SASC has taken part in numerous roundtable discussions with a view to finding ways to address these unacceptable states of affairs. We are realistic and know that these challenges cannot be solved overnight. But with the GMC having now identified where the problems lie, we can at least start taking the necessary steps. Bullying and harassment are not the only issues we face. A study carried out last year by the NHS employees exposed some of the challenges the health service faces in recruiting and retaining SAS doctors. More than half reported that lack of recognition was negatively impacting the morale and motivation of SAS staff, with career progression, pay, and career development among the most frequent reasons for SAS doctors quitting their roles. Meanwhile, the Fair to Refer report into the causes behind the disproportionate numbers of BME doctors being referred to the GMC also made for depressing reading. The study, which was carried out by Dr. Doyne Ativolgan and Roger Klein, revealed that SAS doctors frequently feel exploited and more likely to face serious consequences in the event of making an error. As a result of these findings, they have urged that SAS doctors be given access to learning and development equal to that of other doctors, and that employers be more transparent about the numbers of SAS doctors disciplined or referred to the GMC. Both are recommendations that we would wholeheartedly endorse.
How history will eventually come to view 2020 and its significance remains to be seen. While the pandemic will feature heavily in our assessment, historical perspective will also be focus on a far more long-standing challenge that has blighted the world. We are committed to improving the working life, progression, and development of SAS doctors. On 25th May this year in the US, an African American man named George Floyd was killed after being detained and forcibly restrained by the police. As the world reacted with horror and outrage to this event, doctors around the world fought valiantly against the rising tide of COVID infections. In the NHS, the overwhelming majority of doctors who have lost their lives to this pandemic have been from BAME backgrounds, and there is much to suggest that more could and should have been done to protect a group known to be at greater risk of death from the virus. George Floyd didn't lose his life to the pandemic that is COVID 19. He lost his life to the pandemic of racism and discrimination. Just as we cannot falter in our fight against COVID 19, neither can we falter in the fight against racial discrimination in our profession, in our NHS, and in our society. SAS doctors have long had to face victimization, bullying and harassment, and other forms of gradism in our workplaces and careers. But we know we won't overcome these injustices alone. We would now like to join hands with all other branches of practice in this association to fight against discrimination against all forms of protected characteristics. Please join us because in this way, we believe that we can build a better NHS both for doctors and for patients. Thank you.
Thank you.